A warm welcome to you from the Geneva Learning Foundation. I am Charlotte Mbuh, and I am delighted to welcome you to today's Lightning Chat. And our guest for today is Jan Grevendonk. He is a technical officer at the World Health Organization headquarters in Geneva, Switzerland. And he will be talking with us today on the Immunization Agenda 2030 Monitoring and Evaluation Framework. This is a lightning chat. It's just 15 minutes of your time because we know you are busy. We know you are busy. Just permit that I unmute, that I mute. I mute, and please, if you are not talking, please do mute your microphone, keep it muted until you are invited to speak. Or if you want to say something, just go ahead and raise your hand, and we'll be delighted to give you the opportunity to speak. So I'm going to ask Jan the first few questions, but I'll be looking to you to ask your own questions or leave any comments you may have around the topic in the chat. So my eyes will constantly be on the chat to get you to speak. For our Francophone peers that are with us today, please, if you want to listen to the interpretation in French, vous devez simplement cliquer sur l'icône du bouton du monde en bas de votre écran, l'icône interprétation, et sélectionner la langue, le français, et couper l'audio original pour entendre uniquement le français. Donc, this is for our Francophone colleagues who will be listening to the chat in the French language. And also, if a French speaker is asking a question and you want to listen to what is being said in English, you can click on the icon, interpretation icon, select the English language to hear what is being said in English. So without much ado, I want to say a warm welcome once again to our guest for today, Jan, and who is a technical officer at the World Health Organization headquarters in Geneva, Switzerland. Welcome to you, Jan. Can you just briefly, in a few words, introduce yourself apart from what I've already said, and then we'll dive into the questions.
Thank you very much, Charlotte. Jan Grevendonk, bonjour à tous et à toutes. Thank you for joining and for your interest in the monitoring and evaluation framework around the immunization agenda. I'll try to keep it short, but as was said before, as Charlotte mentioned, if there's any questions and follow-up, we'll be happy to organize kind of maybe even an additional webinar later on if there's kind of technical questions. So my background is that I work in the World Health Organization in the vaccination team and the immunization vaccines and biologicals. And I work specifically on data quality and use. And some of you might know me from previous scholar courses around data quality and use and data quality improvement plans and triangulation. I've also been involved this year with the development of the monitoring and evaluation framework at the global level for the immunization agenda. I'll keep it at that for now.
Thank you very much. And so here's my first question. It's a question that I ask every one of our guests. We know that in countries, many EPI staff have begun to work on the IA2030 to inform their national immunization strategies. Can you tell us, when it comes to monitoring and evaluation of immunization outcomes, what is new or different with the IA2030 monitoring and evaluation framework, and why does it matter?
Yes. So I think the very first thing that is different, maybe not just with the M&E framework, but with the entire immunization agenda, is kind of this focus on leaving no one behind, right? And the focus of leaving no one behind in the M&E framework, we translate that in monitoring the zero-dose children. So zero-dose children, meaning those children that are never reached by immunization programs, by vaccination. And so we measure that in terms of those children that missed a dose of DTP1 or Penta1. So basically, that is a bit different from before, when people were focused mostly on measuring kind of Penta3. So I think this is a very big shift in the immunization agenda and also in the M&E framework. I think maybe a second point that is really different is an emphasis on relative improvements. And when we do target setting, on trying to come up with with achievable targets. So instead of saying like in the GVAP era was the case, like everybody should reach 90% of coverage, we try to see, okay, where do you start from and try to improve that. And for example, in terms of those zerodose children, the target is now to reduce the number of children that are never reached by half by 2030. So this is something that should be, that is the same challenge and should be reachable by everybody, right? Whether you're in a district or in a country or at a global level, you will always have some zerodose communities or children that are never reached. And I think the challenge, your challenge will be to go out and find them and make sure they become fully vaccinated for the life course. And then maybe a third difference that is a bit different from GVAP and Immunization Agenda is that in the Immunization Agenda, there's relatively few global targets or global indicators. So we really kind of rely on countries to think about their program and the indicators that are relevant for them and set up achievable and ambitious targets for those.
Okay, thank you, Jan. And if all of this was to be done, what will success look like in 2030 if the IA2030 monitoring and evaluation framework is used to measure progress and impact throughout the decade?
Yeah, so as we maybe will talk about later, so we have in the impact goals, we talk about a lot of things, but basically at the highest level, we think that during the decade, 50 million future deaths might be averted if all the goals of the immunization agenda are achieved. So that means that right now immunizations are at about like save kind of 4 million people per year, and this includes actually the future deaths as well. So people who are now being vaccinated against HPV, so they will avoid human papillomavirus in decades from now, but we also count those in the estimated model. So we think that immunization has a potential to increase from 4 million lives saved per year to 6 million lives saved. And that is a big difference, we think, and it really is worth it. But to do that, of course, we need to increase coverage. We need to use the vaccines that are being recommended and useful. We need to make sure that outbreaks happen less and less. And yeah, it all starts with kind of that number of zerodose children. So I think the main thing that people will look at this time is really right now in 2019, there were 14 million children in the world that were not vaccinated, right? That were never reached by any vaccination service. So if we manage to reduce that number to 7 million by the end of the decade, I think that will be a huge success. And then if we even manage to also reduce dropout and make sure that those children are included in the life course approach of vaccination, you know, the coverage estimates or the coverage results and outcomes will go up for other vaccines as well. And then if we use all the vaccines at our disposal, I think a lot of extra preventable deaths can be prevented.
Okay, thank you so much, Jan. If you're just joining us, we have our guest today, Jan Grevendonk from the World Health Organization. And please go ahead and ask your questions in the chat or raise your hand to speak. Let your questions be focused on your real relevant problems that concern the work you do as an immunization professional and also the IA2030. So Jan, the IA2030 monitoring and evaluation framework seems very comprehensive and multi-layered. Can you explain it in a few sentences to help those who are listening today understand what is most important about this?
Yes, it's of course a very big document and it's not that easy. It seems a little bit overwhelming, but just to make it maybe a bit easier, so it has two major parts. So the first part is what we call the strategic priorities with the strategic priority objectives, right? So the strategic priorities are the things that we want to do different in the new decade. For example, a lot of focus on demand, on political commitment or commitment in general, and all these kind of things that we think life course, integration, coverage and equity, these things that we think will make a difference in the decade. So all of these 7 strategic priorities that are in the immunization agenda have been described by 21 objectives. So I think that is really kind of where you can measure whether the interventions, the things that are you going to do different, they will all fit in one of these 7 priority areas and one of these 21 objectives. So I think this is the place where you can see whether you're doing the right things as agreed by the global, regional, and national levels, and everybody in the immunization community to actually improve or bring the immunization program to the next step, the next level up. So that is the first set of indicators, which is very important from an operational planning strategic level, right? The second level, which are the impact goals, is really just to measure whether all that work that we are doing is having an effect. And those are the impact goals. Now, there are 7 impact, sorry, I need to think about it. There's 3 impact goals with 7 indicators, right? And these things will really try to measure the impact and the outcomes and the success of the immunization agenda. So this is where we're going to hold ourselves at the global, at the regional, at the national level accountable for. So the way that works, as I said, is we try to reduce the number of zero-dose children, try to reach everybody, then try to make sure the dropout is reduced, they're vaccinated for the life course. We also will make sure that we use all the vaccines that are at our disposal to actually reach those people and prevent future deaths. And if we all do all that, then, you know, like disease outbreaks will be reduced, eradication elimination targets will be reached, and all these additional deaths can be prevented by just reaching the goals of the immunization agenda. So 2 parts, 21 objectives in the SP goals, 3 goals and 7 indicators in the impact goals.
Thank you, Jan. Now we have a first raised hand, Joseph Ngugi. So Joseph, I'm going to invite you to unmute yourself and you ask your question, but please start by introducing yourself. Tell us who you are, where you work, and what you do. Over to you, Joseph.
Hello, good evening, good morning, good afternoon.
Hi, Joseph.
I'm Joseph Gogi. Yeah, I'm Joseph Gogi, Senior Community Officer from Murang'a County in Kenya. My question is, I have a little background in monitoring and evaluation. My question is about the incomplete data which we normally have in most developing countries. How are you going to improve on that to have a complete data? Thank you.
Yeah, thank you very much. It's a very important question. So one also that we, of course, grapple with. I think we have already organized 2 scholar courses, and we might actually continue to do that in the next year or years on data quality and use. And you're totally right that the data is not just incomplete, it's sometimes also inaccurate. You have these denominator-numerator mismatches, population estimates that don't seem relevant. And it's really true that if we are going to look for zero-dose children and we want to use the data to do that, yes, we kind of often have the issue that the data doesn't seem to be very fit for that purpose or kind of high enough quality. Now, there's also the fact that there's actually a lot of data apart from just administrative data and apart from just the health management information system data. So there's also survey estimates, there's surveillance data. And so we did a scholar course on seeing if we can use all the available data to actually make and if all that available data together and through a process we call triangulation can be used to reach the right conclusions. And in this case, for example, a lot of effort will need to be put into finding the zero-dose communities. So those communities in a district, in a county, in a country, in a region that are underserved by vaccination or that are hesitant or that are for some reason not as vaccinated as other communities. And then trying to make sure that we understand why these communities are not equally vaccinated as the rest, and try to design specific interventions aimed at improving the coverage among those communities. I think that this will be crucial. And to be honest, I think we have a lot of data that we don't use already. So we tend to focus on the official administrative data that we get through the monthly reports, for example, and then we see, well, it's not good enough, it's not complete enough, we can't use that. But we could also use, for example, attitude surveys or kind of more qualitative surveys that we can use to find out what stops these people from being vaccinated. So I think we should invest much more in kind of having these additional sources of information, surveys of all kinds, to to give us all the data that we need for that operational decision making. But I totally agree with your question that we shouldn't take it for granted. There is issues with data quality, and we need to kind of, it's a long process to improve them, but also to make use of all available data. So I hope that answers your questions. And we also have like a lot of resources from previous Scholar courses on data quality and use and triangulation that we can probably also share.
Okay, thank you for your answer. It's a good one. And I was asking, because we have a number of monitoring and evaluation experts in the country, and most of them, they are not being utilized in their countries. I don't know how the World Health Organization is doing about it. Thank you.
Okay. Jan, before you come in, I just say Joseph's question is actually in line with my next question, which had to do with practical guidance that you can share to help EPI managers and staff at country level to best use this M&E framework in their work. So why not help them to also use the M&E experts that they have at the country level?
Right. And I think this is a very good additional question. So I think indeed, like, as I said, a lot of the work will need to be done at the country level, right? And actually most of the work. At the global level, really, we're only able to look at the high level outcomes and also maybe some indicators that we selected that give us an idea about what is going wrong or right in terms of implementing the strategic priorities in the immunization agenda. Now, I think for your purposes in any country, I think it would be really great if, so you're going to make your strategic plan, right? Or your national immunization strategy or whatever that is called. And you're also going to develop an M&E framework for that. And we think that if you look at the annex in the resource that was sent in the chat also, and actually that was shared with you, I would say have a start with looking at kind of the SP objectives. So there's 21 strategic priority objectives, and see how relevant they are for your country context. See if all of these things are indeed bottlenecks that need to be addressed or things that need to be resolved before progress can be made. And then for each of these objectives, if you do agree that this is something that you need to work on, you can identify the right actions and also find the right indicators that work best for your context. And in that annex, actually, I think if you go way in the back in the metadata, there's what we call a menu of options for countries to consider, and we kind of propose a number of indicators that could be used to measure that kind of strategic priority objective that we haven't necessarily included in the global framework, but that we think might be useful for regions or countries. For example, if you think that the session's health versus planned is relevant for you and you can collect that data, then by all means do so, because this is not something we can do at the global level, but you could consider it at the country level. So I think, just to make it short, I think my first suggestion would be go to all the 7 priority objectives, the 7 strategic priorities, all the 21 strategic objectives, see if they're relevant for you, see what you can do to improve them, and find the right indicators based on everything that is there. And then if you don't find the right indicator, this will become a work in progress. And of course, we will be here to help you also with that. So the second thing you should also do is then think about the outcomes you want to achieve. And what we've seen in the past is often that the outcomes and the kind of the targets for coverage and kind of disease reduction are often set at a very high level and are not very feasible in many countries. So think about what is feasible in your countries and see where you start from and how far you can go. And think about relative improvements, not just trying to get to 90%, but based on where you're at, how far can you go? Yes, and also like, so I mean, then we're in the impact goals, for example, start with the zero-dose children. Think about, okay, reasonably, how many zero-dose children are in your country, in your district even, or in your region, right? And how many of those do we think can be included in the immunization services by 2030? And try to have like an objective and kind of feasible target that can be used, that is then based on all the work that you're going to be doing and the resources that will be invested.
Okay, thank you very much, Jan. I see there is a second raised hand, Lance Touré, and we have just a little over 10 minutes before we end this session. Lance Touré, okay. Please introduce yourself, okay. Tell us who you are, and ask your question.
D'accord.
Lance,
ok, bonjour, moi c'est Lance Touré, j'appelle depuis la République de Guinée. Conakry. Je travaille à l'UNICEF, j'appuie la coordination nationale du programme élargi des vaccinations. Ok, j'ai bien aimé ce thème, mais avec le timing, on aura quelques soucis parce que c'est important. J'ai une question et deux suggestions. Ma première question, ce que vous avez donné est hyper important avec cet objectif 2030 pour dire que chaque pays doit se créer ses objectifs dans son pays, mais pas un objectif global qu'il doit essayer d'atteindre. On n'a pas le même niveau de départ avec d'autres pays. Ça, c'est très important. Mais en Guinée, par exemple, on vient de terminer une réunion CCIA où il y avait tous les partenaires, l'OMS, Gavi, UNICEF et le ministère de la Santé. Il y a eu un problème sur la définition des zérodoses. Que veut dire zérodose? L'OMS n'a pas la même définition que le pays, le ministère de la Santé en Guinée, qui l'appuie. L'UNICEF n'a pas la même définition que l'OMS et le ministère de la Santé. Et ça, les données, on était perdus dans les données. Alors, ici, je voudrais que vous nous aidiez à définir c'est quoi zérodose. Parce que certains ont dit zérodose, c'est un enfant de sa naissance jusqu'à maintenant qui n'a jamais reçu, même BCG qui n'a jamais reçu. L'autre dit non, non, non. Zérodose, c'est quand l'enfant n'a pas reçu le penta 3. Alors, les gestionnaires de données n'ont pas le même calcul. Ça, c'est ma première question. Deuxième question, vous avez parlé pour connaître pourquoi les gens ne viennent pas à la vaccination ou bien pourquoi il y a trop d'abandon. Avec ma petite expérience de 3 ans en République démocratique du Congo, surtout dans le Haut-Katanga où j'ai fait les 27 zones de santé, j'ai constaté un jour, quand j'ai fait des petites enquêtes rapides dans la communauté, dans cette communauté, il y avait la rougeole. Quand je prends par exemple à Kachoboy, il y avait la rougeole. Les enfants, il y avait une épidémie de rougeole. Mais on était en manque de VAR, de vaccins. Pendant ces temps, c'est ce que la population demande, il y a des décès, mais nous, on vient avec les vaccins polio. On fait les campagnes polio. On vient avec les véhicules polio. La population dit, mais écoutez, polio n'a jamais tué quelqu'un dans notre communauté ici. Mais rougeole a tué hier 3 enfants. On demande les vaccins au centre de santé, il n'y a pas de vaccin. Alors, on ne prend pas vos vaccins et on ne vient pas nous vacciner. Donc, comme on n'a pas beaucoup de temps, j'allais revenir à la situation en Guinée, mais ça, c'est la première question et l'autre, c'était une remarque. Merci.
OK, merci. Ian?
Merci, très pertinent. I'm going to speak English just to make it easier for everybody in the interpretation. So I think very good question. And the first question is a vital one. So what is zerodose children? So let me just start that this was really, it started with kind of a strategic objective of Gavi, basically to think, you know, we see that our big problem is not so much dropout anymore because dropout is being controlled in most parts of the world. But the problem is with the children that never have access to immunization. So, and we think that these children are the same ones that are not just having a lack of access to immunization, but also to other health services like nutrition, even schooling and everything. So they're the marginalized communities or the missed communities and or whatever you want to call them. And we actually, I think it's almost better to think about zerodose communities or missed communities or underserved communities than about zerodose children. What we did is actually we identified, at least at the global level, and we also want to propose this for the national level, an indicator that best measures the existence of large groups of the population that never receive any vaccine. And so the operational definitions of this is lack of Penta-1 or lack of DTP1, right? So we didn't want to include BCG because BCG is often given through a different system than the public health system. But we think that children who never received even a first dose of DTP or Penta, they will be much less likely to get any other doses. We also didn't want to count children that get polio or measles through a campaign, because we think it's important that we are able to serve all the children through the routine services, through the facilities, not only through campaigns, right? So that is how we measure it from the global level. But in the end, that is just an indicator. The zerodose indicator is just that. It's an indicator to measure the success. Actually, the priority or the goal is to immunize everybody and to make sure that everybody is accessed by the immunization program. So I don't know if that answers the question, but there's a lot of discussion about the zerodose. And it's true that, of course, zerodose in itself is not the goal. It's not the goal is not to give like 1 dose to children who before didn't have any dose. The goal is to fully immunize them, and then for the life course, not just with penta or with measles or with whatever, but for the life course, right? The only thing is to simplify it for the measurement framework. We defined zero-dose children as children that never received penta 1. So this is what we want to measure. But again, the intervention shouldn't really focus on that penta 1. The intervention should focus on making sure that we reach everybody and include them for the life course. So I don't know if that clarifies, but it is a very tricky suggestion, and I have actually have a few slideshows also that I can share with that actually discuss exactly this topic.
Thank you. Yes, Jan, please go ahead.
Yeah, and then you had a few additional suggestions on dropout rate, and I totally agree. Dropout rate in itself is a very big problem, especially in countries with very weak health systems. Like, for example, I think you're right, in DRC and Central African Republic, there's a lot of dropout rate, and we should also not forget that issue, especially for those countries. And those countries that see a big dropout rate should also think about why this is happening and what can we do to stop that. And finally, of course, totally agreeing with you that the vertical approaches where we just go with polio or measles for that matter, instead of thinking holistically what a population needs, I mean, that is not going to get us very far, which is also why life course and integration, of course, is this very important strategic priority in the immunization agenda.
Okay, I think we are almost out of time, so I'll just share my last question for you, Jan, is it's difficult to talk about IA2030 without looking at what is happening right now. That is COVID-19 pandemic and the COVID-19 vaccine rollout, which have shown that things can quickly change in the world within a very short time. So is there room for change and updates in the IA2030 monitoring and evaluation framework before the end of the decade? What are the factors that could favor such a change?
Yes, so in the immunization agenda, we use what we call learning agendas. And learning agendas are things that we say, okay, we want to improve this, but we don't know exactly how yet, or we don't even have all the data to see what the baseline should be or what our target could be. So there's a number of things like, for example, access to vaccines, demands, all these things that we say, okay, these are really learning agendas. We don't want to lock in yet. I mean, we will be open to change over the agenda, over the life cycle of the agenda. So I think the only thing that is really maybe more fixed are those impact goals, right? Getting better coverage and reducing the zero-dose children, getting to these disease elimination and eradication targets. I think those, if we miss that because of COVID, that is also possible, but then at least we need to live up to that and say, okay, why did we do that? Just to say that COVID, of course, made a very negative and drastic impact in the first year. In 2020, we saw that there's many more zero-dose children. There's a lower coverage. There's almost no vaccines that are being introduced. So, and we knew that, of course, we knew that COVID was going to set us back a bit. Even COVID vaccination is going to set us back because that COVID vaccination is taking the same resources from the health system that we need to make progress for routine coverage of other diseases. So I think we really need to learn how to work with COVID because COVID is not going to go away in the short term, and see if we can even use kind of the COVID resources to help improving the immunization agenda. I think your question is really a good one. It's like, it's a changing world. It's also changing priorities. But I think we need to be sensitive to that, and instead of just pounding ahead, say, how can we now say, okay, that we see commitment from governments to work on COVID vaccination. Can we use that same commitment, for example, for childhood vaccination, right? These kind of things we need to, and of course your question is, yes, we should be flexible and open to that. And I think we're totally open to change the strategies as we move along in the decade.
Okay, thank you very much, Jan, for, unfortunately, we are out of time. So if you have more interest in this topic, please go ahead. The resources, the link to the resources is in the chat. You can explore more on that. But I also want to say we have more lightning chats in view. And right now you can, in a short while, we are going to start with our next lightning chat on gender and health, introduction to gender and health. And if you want to to join us, please do not hesitate to do so. We also want to hear your feedback. What do you think about this lightning chat? What can we do? What's your experience like? What can we do to improve? And I'm going to share these links with you on the chat. So please kindly fill these forms to tell us how you are doing. So continue to keep your eyes on our different platforms for the link and times for our different lightning chats, and do not forget to let us know how we can do better. Thank you, Jan, once again for being here today and for answering our questions.
And if I can quickly also say, like, apart from feedback, if you have additional questions or suggestions to make, you can also use that same link and we'll try to come back to that.
Okay, thank you so much, and bye for now.
Thank you.